evening, and welcome to the Green Table Talk Goes Red for Heart Health and saving the hearts of our mothers, daughters, and sisters. We now welcome Eastern Area Program Coordinator Anna Maria Bishop Harris.
Good evening, everyone, and thank you so very much for joining us. I truly appreciate your presence here this evening. It does mean the world to me. We have a rich program that we have been working very hard on just for you. You're going to enjoy yourself. Sit back and hear about how to best protect your heart. Our overreaching theme in the Eastern area is New Year, New You in 2022. And one of the best ways to protect yourself, protect the health and safety of your family, is by making sure you take care of all aspects of your heart health. If you're not a mother, you might be one day. If that's no longer an option, you're definitely a daughter, and you are most certainly a sister, even if you are a sister with. So we appreciate you joining us this evening. And now it is my great pleasure to introduce our Eastern Area Director, Dr. Shawana Tucker. Shawana.
Thank you so much, Anna Maria, and good evening, everyone. I'm very proud to bring you greetings on behalf of the officers, leadership team, and over 4,600 members in 80 chapters from the Eastern area. We are glad that you have joined us for this important Green Table Talk on heart health. We created the Green Table Talk series here in the East in the fall of 2019. It was designed to be a conversation with influencers and experts on timely topics we need to talk about, pay attention to, and take action on. Tonight's discussion, Saving the Hearts of Our Mothers, Daughters, and Sisters, fits that description to a T. Important to spotlight, worthy of attention, and essential for action. The Links joined the rest of the country in spotlighting and promoting cardiovascular health and wellness this month as part of our organization's broader focus on health and wellness. We recognize the role of heart health in overall wellness, which in turn impacts the overall quality of life for our communities today and tomorrow. We also know that Black women are often inclined to put on their superwoman cape and take care of everyone in their families, their communities, and their organizations without stopping to take care of themselves. Our Sister Links are standing together this evening to lovingly say that this has got to stop. It is critical that our mothers, daughters, and sisters pay attention to their own health, especially as it relates to the heart. We know that heart disease and hypertension are in the top causes of illness in Black females. Also included in that list are stroke, diabetes, and kidney disease, which all are impacted by or can impact cardiovascular health. We are pleased to have two experts, Dr. Marie Devereaux Padilla and Dr. Laurie Zephyrin, who will share information, insights, and resources on this important topic. We thank you for their willingness to share and know that we will all benefit from having spent some time with them. In closing, we hope as a result of this evening, you will be inspired to consider your own health, as well as have a conversation with other women in your life. Think of it as the ultimate Valentine or love letter from you to yourself or you to others. Now let me turn it over to our own Eastern Area Health and Human Services co-chair, who is also a cardiologist, Dr. Anjanette Ferris-Senatus. Anjanette?
Thank you so much, Dr. Shawana Tucker Sims, our wonderful Eastern Area Director. We thank you so much for allowing us this opportunity to discuss heart health and relate it to maternal health. Good evening, everyone. Thank you for joining us. On behalf of the Chair of the Eastern Area Health and Human Services Facet, Chair Siobhan Arline Bradley, and the Eastern Area and Health and Human Services Committee members, we bring you warm greetings this evening. Thank you to our Eastern Area Director, Dr. Shawana Tucker Sims, and our Eastern Area Program Coordinator, Director Anna Maria Bishop Harris, for welcoming us. Heart disease remains the #1 cause of death in our country for both men and women. February is Heart Month, and we're gathered this evening to learn about heart disease prevention and maternal mortality, which disproportionately affects our communities. We'd like to take this moment to recognize the American Heart Association Eastern States for being a supporter of this event, and we applaud and support the American Heart Association in over 100 years of fighting heart disease and stroke. We also thank Alvin Ailey, American Dance Theater, and the Ailey Extension for their support of this event. Movement is extremely important, and we are going to be treated with a movement piece this evening after our discussion. Today, we have two dynamic speakers to discuss cardiovascular health and maternal health. We are honored to welcome Dr. Marie Devereaux Padilla, cardiologist and partner at Premier Cardiology, and Dr. Lori Zephyrin, obstetrician, gynecologist, and also Vice President of Advancing Health Equity at the Commonwealth Fund. Their presentations will be followed by a question and answer period, and we will conclude the evening with movement from the Ailey Extension. Please kindly enter your questions in the Q&A. Thank you very much. And now I will introduce our first speaker, Dr. Marie Devereaux Padilla. Dr. Devereaux graduated magna cum laude from CUNY Medical School in 1997 and received her doctorate of medicine from New York University School of Medicine. She completed her residency at Columbia University, New York Presbyterian Hospital in 2000. And she completed her fellowship in cardiology at Columbia Presbyterian in 2005. Dr. Devereaux is board certified in internal medicine, cardiovascular disease, nuclear cardiology, adult echocardiography, and vascular interpretation. She was previously an assistant professor at Columbia University College of Physicians and Surgeons. She is currently a partner at Premier Cardiology with multiple locations in Long Island, New York. She specializes in all aspects of cardiology, including women's cardiovascular health and preventive cardiology. In addition to her professional endeavors, Dr. Devereaux is involved in several civic and philanthropic causes. She is a former board member and current member of the Association of Black Cardiologists, supporting efforts to decrease health disparities in our communities. She's a member of the American College of Cardiology, American Society of Echocardiography, American Society of Nuclear Cardiology, and the American Heart Association. Dr. Devereaux has also been a guest speaker on several local radio stations focusing on closing the health disparity gap. Dr. Devereaux serves as the current president of the Eastern Shore, New York chapter of the Links Incorporated. Please join me in welcoming Dr. Devereaux.
Thank you so much for that wonderful welcome. Hello, good evening, Madam Eastern Area Director, Madam Program Coordinator, and Madam Health and Human Services Co-Chair. I am so excited and honored to be a part of this forum. We are here to educate ourselves on how we can continue to save the hearts of our mothers, daughters, sisters, and how to keep our heart healthy as well. Did you know that the United States has the highest maternal mortality in the developed world? About 700 women die each year in the United States as a result of pregnancy or one of its complications. Black and American women are 2 to 3 times likely to die from pregnancy-related causes, more so than others. We are even 5 times more likely to die from pregnancy-related cardiomyopathy and blood pressure disorders than other races. We are 3.2 times more likely to suffer from dying from pregnancy. So our pregnancy-related mortality ratios still don't even improve, even with education. In the United States, 1/3 of pregnancy-related deaths are attributed to cardiovascular disease. Cardiovascular disease is the leading cause of maternal death, and it is responsible for more than 1/3 of pregnancy-related deaths, including peripartum cardiomyopathy, cardiovascular conditions like heart attacks, clots in the lungs called pulmonary emboli, and uncontrolled hypertension that can lead to disorders called preeclampsia. We're seeing more women choose to become pregnant at older age. And with this, these older women, like ourselves, have higher likelihood of having conditions like high blood pressure. And the most important thing to know is that the risk doesn't stop after you give birth. It continues up to 1 year after delivery. That's why it's important for you to know about the fourth trimester, which refers to the 12 weeks after delivery. That's a time of increased stress, mental health, and there's a high risk of still getting diseases like preeclampsia postpartum. What we know is that 1/3 of deaths happen during pregnancy, a third happen the week after or during delivery, and a third happen up to 1 year. So we need to be on high alert for our sisters. What happens to your heart during pregnancy? During pregnancy, our blood volume increases 30 to 50% to nourish our growing baby. During labor and delivery, we must handle extreme changes of blood flow and pressure changes. We see increased cardiac output, we see increased stroke volume, that's how much your heart is pumping, and we see increased heart rates, just so we can increase blood flow to our baby. So when we have older women coming and choosing to have babies, what we see is the heart muscle becomes thickened already. So if you had high blood pressure and your heart was pumping against a high pressure, your heart muscle's working harder. Just like a weightlifter, the muscle thickens, and that's called cardiac remodeling. So if you already have a thickened and conditioned and cardiac remodeled muscle, and then you add the stress of having a baby, that's where the risk of stroke and other damage to your organs start to occur. We know that African Americans have the highest rates of high blood pressure. It's several reasons that cause this, including genetics, environmental factors, stress, and obesity. 75% of Black women have high blood pressure by the time they are 55 years old. Ooh. This was found out in a Cardia study where they followed more than 1,100 women for 30 years. By the time you're 39, when a lot of women are choosing to give birth today, 30% of them will already have high blood pressure before they become pregnant. So there are 4 categories of hypertensive heart disorders during pregnancy. Chronic hypertension means that you had high blood pressure before 20 weeks of gestation. A gestational hypertension is after 20 weeks that your body develops high blood pressure. And then there's preeclampsia and eclampsia when you start getting organ damage. If you have chronic hypertension, you need to see your doctor right away because you're at risk of being on medication that could be dangerous for the baby. And many of us are likely to die from preeclampsia. That's when you have high blood pressure and the filters in your kidneys are damaged during pregnancy and protein leaks into your urine. This sign can put you at risk for having seizures in the future. So if you see your hand swelling, your face swelling, and your body swelling when you're pregnant, it's so important to go to your doctor immediately. There's high risk factors to know if you're likely to have preeclampsia, including race, your age, having a history of kidney disease, if you have type 2 diabetes. And if you have any of these things, you should talk to your doctor about being on possible preventative low-dose aspirin. It has been shown to help. Another thing is, if you have a history of any kind of heart problem, you're likely to have heart damage.
The cardiac muscle is damaged by conditions such as an infarct, high blood pressure, or other diseases. This damage is known as cardiomyopathy and most commonly affects the left ventricle. In order to supply sufficient blood to the body, the damaged muscle must work harder, resulting in higher stress. With increased stress, the wall dilates or stretches out, becoming thinner. The ventricle is unable to contract to normal levels, and its oxygen consumption becomes more inefficient. An ongoing process, the ventricle enlarges, and the heart takes on an abnormal circular shape. This is known as dilated cardiomyopathy.
So as you can see, if your heart is already working hard, and then you're adding the stress of a baby and the increased volume that you're carrying around, which could be several liters of fluid, your heart can stretch out because the pump won't be strong enough to handle it. So this is called peripartum cardiomyopathy. Cardio means heart, myopathy means weakness of the muscle. If you have signs of shortness of breath or leg swelling, and you know you're of African American race, and you have a history of high blood pressure or being overweight, it is so important that you ask your obstetrician to get special treatment from a cardiologist. There's a new movement now that we're saying that we need to have a multidisciplinary approach to take care of women who are so high risk, and this is called cardio obstetrics. And we know that if we give you the right medications, that there's a chance that your heart function will recover. So even if your heart function were to drop below 45%, we know your heart function can recover with the right meds, and we know 20 to 70% of these patients will get better. However, you still will be at high risk of having a weak heart again at your next pregnancy. Another thing that we see with high blood pressure is when your heart, we see the pressures in your body pumping so hard, sometimes the vessels can damage and you can have bleeding at the end vessels in your brain. That's called a hemorrhagic stroke, where you can bleed into your brain, and that's more common during pregnancy because of the multiple different hormonal changes and relaxants that are put and make your vessels a little bit weaker during pregnancy. So if your face droops or you have arm weakness or speech difficulty, time is critical for you to seek help. Other red flags for us to consider are, is your heart rate greater than 100 all the time? Is your blood pressure staying greater than 140? The American College of Cardiology recommends that blood pressure remain below 130 over 80. While we know that these lower blood pressures are associated with lower risk, sometimes women are not treated quickly enough. So if you have obesity, diabetes, high blood pressure, it's important to look at these charts with your doctors to make sure that you're seeing the appropriate specialists, like maternal fetal medicine, a primary care doctor, as well as a cardiologist, to make sure you're getting the right treatments. So this is the team-based approach that we're trying to educate people about, and it's called cardio-obstetrics, where we have cardiovascular medicines, and maternal fetal medicines are subspecialists who are obstetricians who specialize in taking care of higher risk pregnancies. So if you have high heart disease, high blood pressure, preeclampsia, diabetes, thyroid disorders, kidney disease, you should ask for help from one of these. And then you want to develop a preconception, pregnancy, labor and delivery, postpartum, and fourth trimester plan that includes follow-up with your team. So we see all these disorders of cardiovascular system, from pumping to having high pressures in your lungs, to shortness of breath, to having electrical problems with pregnancy in our high-risk women. And we know 60% of the complications can be prevented with the correct treatment and work from a multidisciplinary team. And what can you do in advance? In advance, of course, we can live Life's Simple 7, which is from the American Heart Association, 7 simple ways to stay healthy, including managing your blood pressure. Keep your blood pressure less than 130 over 80. That means we want your blood pressures 120 over 70s. Reduce your blood sugar, get active, control your cholesterol, know your numbers, lose weight, eat better, and of course, don't smoke. And when you get pregnant, you can actually still continue to exercise. The recommendations are that throughout your pregnancy, you exercise around 150 minutes a week, of course, safe, low impact exercise, proved by your obstetrician or cardiologist. And other factors that influence maternal mortality that we should talk about, which our Madam Eastern Area Director did mention, is the Superwoman schema. So Dr. Michelle Albert is the first Black woman who has been elected to be the president of the American Heart Association, and she will assume her presidency in July of 2022. And she recently put out a great article talking about the effects of stress on African-American women. The Superwoman schema is a combination and phenomenon of gender and racial oppression's effect on our bodies. And it's called the cumulative biological stress. And that's called the allostatic load. While we all know that we all suffer from this, now it has been quantified in scientific research. And the increased stress that we suffer from as African-American women, including the histories of oppression, race and gender, disappointment, mistreatment, abuse, spiritual values, and trying to take care of everyone, puts us in a superwoman role where we see inflammation in our bodies that leads to anxiety, depression, impaired immunity, and cardiometabolic conditions like increased likelihood of having high blood pressure. And it affects us long-term. So this is something that we should all do to work on limiting our load and finding balance in our life, in addition to living life's healthy steps and getting the right treatment and care at the right time. Thank you so much for taking the time to listen to me during this presentation.
Thank you so much, Dr. Devereaux, for an excellent presentation and for reviewing all that we should know about pregnancy and our heart health, and also focusing in on our heart health with Life Simple 7's information that we can take with us, no matter if we're a mom, a daughter, a sister. So thank you so very, very much.
You're very welcome. I was very honored to attend.
Thank you. And now we will shift to our second speaker, Dr. Lori Zephyrin. We are replete with rich information this evening. Dr. Zephyrin is Vice President of Advancing Health Equity at the Commonwealth Fund. Previously, she was Vice President of Delivery System Reform. Her work at the fund has included advancing health equity in delivery systems and health policy, promoting high-quality comprehensive primary health care, and promoting equity-centered care for birthing people throughout the life course. She combines her experience as a clinician, health policymaker, and health systems innovator to her role at the Commonwealth Fund to drive delivery system change. Dr. Zephyrin has extensive experience leading the vision, design, and delivery of innovative healthcare models across national health systems. She was the first national director of the Reproductive Health Program at the Department of Veterans Affairs, spearheading the strategic vision and leading systems change and policy to improve the health of women veterans nationwide. She served as acting assistant deputy undersecretary for health for community care and later as acting deputy undersecretary for health for community care. While directing the VA's community care program, Dr. Zephyrin spearheaded efforts to implement legislation, develop internal governance structures, and address patient outcomes through system-wide transformation of care delivery. As part of the leadership team, she also represented the VA before Congress and other internal and external stakeholders. Her perspective and experience as a systems thinker and a leader provides refreshing insight on healthcare delivery and advancing health equity. Dr. Zephyrin has written articles and has been featured in various publications, was named a White House Fellow, Young Global Leader, Robert Wood Johnson Clinical Scholar, and Aspen Health Innovator Fellow. Dr. Zephyrin earned her medical doctorate from the New York University School of Medicine, MBA and MPH from Johns Hopkins University, and BS in Biomedical Sciences from City College of New York. She is a board-certified obstetrician and gynecologist and completed her residency training at Harvard's Integrated Residency Program at Brigham and Women's Hospital and Massachusetts General Hospital. Please join me in welcoming Dr. Zephyrin.
Thank you so much, Dr. Anjanette Ferris-Senatus. I am so honored to be here with all of you today. Thank you to Dr. Shanna Tucker-Sims and Mrs. Maria Harris. And thank you for the invitation. Thank you, Dr. Marie DeVario, for the wonderful presentation before. So today I just wanted to talk about maternal health in the US and really just share some insights in terms of how can we address this in a meaningful way? And it's actually very timely that we're having this conversation today because the CDC today released some new data about maternal health in the United States. And I'm going to try to move my slides. And these rates that the CDC released today really just shows a continuing grim outlook in terms of just the increasing rates of maternal mortality in our country, as well as just the increasing inequities that we're seeing. Right in front of you, you'll just see just the bar graphs just showing the increasing rates from 2018 to 2019 to 2020, and just the significant disparities when we look at Black people and Hispanic people. What's not here are data on Native American people, and those rates are also show significant inequities. And it's really important as we think about these rates, and Dr. DeVario mentioned it earlier, and so did, I think, Dr. Senatus, just when we compare ourselves to other high-income countries, we in the United States have the highest maternal mortality rates compared to these high-income countries. And I'll talk a little bit about why a little later as well, but it's really shocking to see that. And a lot of it is related to just the fact that in this country, there isn't universal health care. So not everyone has access to health insurance, and just different models in terms of how care is delivered. This doesn't mean that there isn't inequities in these other countries. There are significant inequities, Black-white inequities in or Indigenous people, white people inequities in these other countries as well. But when we look at the overall data, the rates are just significantly lower. And when I think about the causes of maternal mortality, I think about the importance of care before pregnancy, during pregnancy, and after pregnancy. And about a third of the deaths that we see are during pregnancy, and about more than half are after birth. And Dr. Deverio said a third, a third, and third, which is absolutely correct. This data just sort of breaks up those last 2/3 into from birth to beyond. And so what's really important is, as we think about how we deliver maternal health care in this country, it doesn't stop after the baby's born. We also have to think of mom and family and baby and their health even after birth, and how we enter pregnancy and how we leave after birth is also really important. It's also important to understand the impacts of the drivers of health or social determinants of health in terms of like safe, affordable housing, a living wage, education, transportation, availability of food, social connection and safety, job security, and also the impacts of structural racism, which I'm going to talk a little bit about as well. And when we think about, we've learned a lot in, you probably have heard a lot in terms of just improvement in healthcare is not enough to improve health. In fact, going to the healthcare system and getting healthcare from your healthcare provider is such a small part of what makes us healthy. It's our behaviors, it's our physical environment, it's the stress that we feel. Dr. Deverio talked about allostatic load, which is very important. It's also the socioeconomic factors as well. Do we feel safe? Do we have enough? Is there enough income? Do we have family and social supports? Are we stressed about our jobs, et cetera? It's also, we're talking about mortality today. I also think it's important that we also think about maternal morbidity, or essentially, I think of them as the near misses. So, people that experience complications during pregnancy that they have to, may have had a near-death experience or had some injury as a result of pregnancy. And that's even increasing significance as well, because that impacts how people navigate through health and life. There are many birthing people that experience just traumatic birth, have traumatic birthing experiences that really impact their long-term health overall. And we did an analysis where we looked at the costs of that over time, and really some societal costs are in the upwards of billions of dollars in terms of just impacts on people's health and wellness. And, I want to just talk about why are people experiencing high rates of maternal mortality. We talked about cardiovascular disease as one of the main causes of maternal mortality, also preeclampsia and obstetric embolism. However, these are 60 to 70% preventable. We talked about the increased comorbidities and stress that relate to that, but there's also delays in reaching and accessing care, delayed diagnosis by providers, presenting with more severe symptoms and advanced disease, either because of having a delayed diagnosis or having a delay in reaching and accessing care. And also when people reach the healthcare system, not receiving appropriate care based on standards. And then why do Black and pregnant and birthing people not receive risk appropriate care based on standards? Well, there's less access to care overall, including primary health care, right? There's concentrated use of hospitals with poor quality indicators. There's really an important study by Dr. Liz Howell, which showed in New York, just hospitals in Black serving communities had poor quality indicators, and also Black people not being listened to by providers. And so why do these factors disproportionately affect Black birthing people? There's the importance of understanding structural internalized racism and the connection between gender and race and that intersectionality, the impact of residential segregation, access to poor quality hospitals, implicit and explicit bias of providers, and the disproportionate impacts of the drivers of health. And it's really important to really have an understanding of this legacy of systemic racism that can be entrenched in policies and practices that affect one's health in terms of how they come to the healthcare system and the stress and the allostatic load and the weathering they may experience, and also how they're treated when they get within to the healthcare system. And we also, the other sort of elephant in the room is this colliding crisis of COVID-19 and maternal health. And, thinking sort of the risk of COVID-19 to pregnant and birthing people, the strained healthcare infrastructure across the country, just having to deal with this pandemic with underinvestment in public health and healthcare infrastructure, worsened pre-existing chronic conditions. So many of us have not been going to the healthcare system, not been going to the doctor because of fear or because of just unable to get an appointment. And so you're probably hearing of just, the importance of getting back into healthcare because many of us have put our healthcare needs on hold, increased mental health concerns, and also the significant income impact and worsening of the drivers of health as a result of this crisis. And when I think about levers for change and thinking about how do we address and actually have some change in the rates that we're seeing, it's multifaceted. It's going to require not only some of the individual work that needs to happen in terms of really being able to take care of ourselves as a community, but it's really going to require policy reform at the state and federal level, as well as delivery system change. And when I say delivery system change, I'm talking about healthcare systems really looking internally at their data in terms of the care that they're providing, in terms of who's not getting equitable care, and really being able to be held accountable to address that in a meaningful way. And then also community investments. And I think a lot of these changes really have to come from the bottom up, with significant investments in the community as a key lever for change. I just wanted to talk a little bit about the Black Coalition for Safe Motherhood. This organization was co-founded with Dr. Leslie Farrington. And it's, as we go to the healthcare system, I always say that going to the healthcare system can be just a stressful experience. There's already a power dynamic because I may go to the healthcare system because I'm concerned about something about my health, and I may have a question, and I'm going to someone for information. And so that in itself can be a very challenging situation. And so the Black Coalition for Safe Motherhood, we've come up with a few ways to try to help people understand that when they're coming into the healthcare system, they have a right to be able to ask questions until they understand the answers. They have the right to learn and to know about their pregnancy, and the right to make educated decisions based on what you prefer for yourself and your family. It's also important to claim your space, right? The right to say no decision about me without me, the importance of making your wishes known. Also, it's important to trust your body, like to know if something's not right. Many a times when I hear stories about people that have gone to the healthcare system, they felt something was off, not right, and their healthcare provider may have dismissed it or didn't believe it. And it's really important to trust your body until, and talk to that provider or other providers until you get your questions answered, and also tell your story. It's really important to share that story, to really make your voice heard, and tell your support team and your provider if you feel safe. Now, this doesn't take the onus away from the health systems that need to also ensure that they're creating an environment where this is possible and providing the highest quality care. Nor does this take the place of policy actions that need to happen to make change. But this is also, a rubric to try to help, ensure that this conversation between you and your healthcare provider is actually a two-way conversation. I also like to, I've talked a lot about just, some of the negative data out there, and that in itself is also very stressful. When I talk to, a lot of birthing people, you feel just stressed and just, overwhelmed with all of the negative data. And, I love the work that Dr. Kimberly Seals Allers is doing. She is a journalist. She developed an app called the Earth app, which is, you drop the B for bias, which essentially tracks tracks essentially instances of systemic racism within health systems, and her goal is to make health systems accountable for Black women's experience within the healthcare system, Black women and birthing people. But she also has a podcast called The Birthright, and it's running in its second season. And the goal is to also highlight positive maternal health outcomes, really, and to really voice and show powerful, positive birth stories. And I think it's really important. And I don't know who said this. It might have been Kimberly. With joy, to be able to also seek and display and talk about the joy of birth, as well as to be able to talk about the pain that we're experiencing as a community as well. And I talked a little bit about the policies that could advance maternal health. I think this is a really important time in our country where there's an administration that's focused and thinking about and talking about gender equity and racial equity. Recent legislation has given states the option, for example, to expand Medicaid coverage to up to a year postpartum. And there's, the Black Maternal Health Momnibus Act, which is a legislative package of bills that centers Black women and aims to really address many aspects of the maternal health crisis. I'm hopeful that this work and this legislation will move forward and can really help address just the crisis that we're seeing in our country today. But I just want to thank you for your time. Thank you for having me today, and really looking forward to your questions.
Dr. Zephyrin, thank you so much for your excellent presentation, very thorough, and provided us with a lot of information. Thank you so much. And now we're going to have a discussion a bit about all that you and Dr. Devereux presented on maternal mortality, maternal morbidity, and our overall cardiovascular health. So I want to start with you, Dr. Devereux. You touched a bit at the end of your presentation on the American Heart Association's Life Simple Sevens. And I think for most of us, we want to know kind of what we can be doing each day or just in general to help reduce our risk of heart disease. So can you just talk a little bit more about that?
All right. So the most important thing that we want to remember is that we want to try to live a healthy life. And what does it mean to be healthy? And I'm just going to put that back up so everybody can see. What it means is like living in a way that we know reduces the risk of dying. So the number one thing that we can do to live longer is manage your blood pressure, reduce your blood sugar, get active, control your cholesterol, lose weight, eat better, and stop smoking. Research has shown if you can incorporate these 7 steps into your life, you will live longer and decrease your risk of long-term morbidity and mortality.
Thank you so much. I mean, it's so, there's so much that can be prevented from a cardiovascular standpoint just by lifestyle modification. So I'm just happy that you stress that. And Dr. Zephyrin, I'll turn to you a bit on kind of the drastic statistical difference in maternal mortality in our country compared to other high income countries. And you did touch on some of the reasons, but what are your thoughts? You do all of this work, and what are your thoughts about why there's such a dramatic difference in maternal mortality in this country? And then we could spend an entire day digging into the differences between ethnic and racial mortality in our country. But if you can touch a bit about what what other factors may be playing into that.
That's an excellent question. Thank you, Dr. Senatus. So I think there's a number of ways to think about it in terms of why is it that we have such higher rates in the United States compared to other high income countries? Actually, we're last when it comes to maternal mortality. We're also last when it comes to affordability of healthcare. We have the highest healthcare costs in this country. And so when we look at the comparisons, our analysis really looks at like system structure, right? These countries have universal healthcare. Healthcare is a human right. everyone has access to healthcare regardless of income or employment. And that's absolutely critical, because regardless of whether you have some coverage or little coverage, just the out-of-pocket costs in this country are enormous. Also, the model of care is really important. In the United States, our healthcare is very fragmented. You may or may not have a primary care doctor, and then when you're pregnant, you're transitioned out and you have to find your own obstetrician. And then after you're pregnant, you all of a sudden have to find care. That's just that's really difficult for people to navigate. So the seamless transitions is important. In these countries, they invest in primary health care, maternal health care, there's seamless transitions. The other piece is the midwifery model of care is center in many of these, in these countries. And I'm an OBGYN, and I believe in the midwifery model of care. It's critical, it's important. There's also the complementary role in these countries of midwives and doctors. And so we have just low investment in maternal health providers in this country. We don't invest in OBGYNs, we don't invest in midwives, and we have a very low number of midwives compared to these other countries. I think the other important piece is postpartum coverage, and that goes to this seamless transition. Like after birth, you're all of a sudden supposed to figure out not only how to take care of a child, but also take care of yourself. And a lot of things get missed between that birth to 1 year period. Whereas in these other countries we've seen that there are home visits, nursing home visits that are included. You're seen by your provider multiple times. There's seamless transitions into primary healthcare as well. I think the last thing is also the drivers of health. There's universal paid leave, which is really important to be able to allow people the time to take care of themselves and their families.
Thank you so much. And that was going to be another one of my questions that you answered about the incorporation of midwives, and really we're behind other countries in that. And of course you are an obstetrician gynecologist, but you also welcome that component, and I think it's important. And so thank you for addressing those issues and kind of maybe digging into why this disparity exists, because it's quite tremendous. And I'm going to go to Dr. Devereaux. Dr. Devereaux, some may ask, if I have heart disease in my family, and of course there are different types of heart disease, really kind of specifically looking at coronary artery disease. Am I likely to develop it? Is it very cut and dry? And just wanted you to kind of address that.
Well, I mean, if you do have a family history of coronary artery disease, there is a genetic component to certain types of coronary artery disease. So it's not cut and dry, as you alluded to. It's actually a spectrum. So as we know, when we have babies, we can inherit a different set of genes, and the genetic component of heart disease, that's the non-modifiable risk factor. Like another non-modifiable risk factor is your age. So we can't change those two things, like what you inherit, but the environmental risk factors, which are modifiable, we can change. Like we can change how much we weigh, and we can work on our diets. We can change our level of activity, what we put inside of our bodies, and our food. However, if you do have a family history of heart disease, specifically as African Americans are now having research that's showing that there is a genetic component to hypertension, it's very important that we start screening very early. So we say from the age of 18, African Americans should really have their blood pressure checked annually at their physical examinations. Specifically, since we know there's an early incidence. In other words, African Americans are more likely to develop high blood pressure earlier than others, leading to long-term complications. And we're more likely to have end organ damage. That means if your pressure is really high and you're supposed to have like a garden hose pressure in your body and you have fire hose pumping around, you have chronic microscopic damage to your eyes, to your kidneys, and to your heart. Specifically with the kidneys, we see that African Americans are most likely to be in dialysis. Then we see heart failure, where your body fills with fluid because your heart has been struggling so long. So it's so important that we know if you keep your blood pressure controlled, you do everything right, you can avoid all of these things. And even if you're pregnant, if you're a little overweight and your blood pressure is high, if it's controlled, you can prevent all these complications we spoke about. 60% of everything we spoke about is preventable. And that's the positive. We have success stories. We just need us to get there, get the care, and ask for it.
Thank you so much. I could be here all evening speaking with you both, and we are just truly, again, honored to have you here this evening, sharing a wealth of knowledge with us. And now we're going to practice what we preach and really put some of this into motion and really kind of move into a movement piece, because kind of activity is important. And so we get the knowledge, but we also want to follow that with action. So thank you so much. We truly, truly appreciate all that you shared with us this evening. And I'm going to now introduce our Arts Facet Chair, Mrs. Carol Seal Council, who heads our phenomenal Eastern Area Arts Facet, and she will bring greetings and will introduce the Ailey Extension for our movement piece. Thank you so much.
Thank you. And thank you to all our presenters. What an interesting conversation, especially on a personal note, as I'm going to see my cardiologist next Tuesday. So a lot of information that we all need to learn. And one of the things that they talked about was get active. And that's what we're going to do in the next 15 minutes. We want to follow up on the wonderful information you have received tonight. Our own Anna Maria Bishop Harris worked with the Alvin Ailey Dance Theater, who prepared an exclusive dance class for you to participate in tonight. I'd like to tell you about Lisa Johnson Willingham. She is the director of the Ailey Extension. Lisa has expanded Alvin Ailey's vision that dance is for everybody. And she has done this through dance programs for students of all ages. Since the inception of the Ailey Extension in 2005, Lisa has attracted students through virtual offerings. The Ailey Extension now has a global audience of over 43,000 students in more than 70 countries. So please join us in this unique opportunity. You're going to see modified choreography from the Alvin Ailey's iconic Revelations for you to participate in. Relax, breathe, and enjoy. Thank you.
The Ailey organization offers dance performances, training, education, and community programs to enlighten, unite, and inspire all people. In addition to Alvin Ailey American Dance Theater, the Ailey organization includes Ailey 2, the Ailey School, Arts and Education, and the Ailey Extension. Ailey 2 was founded in 1974 to help the most talented students from the Ailey School to make a leap from studio to stage. Ailey 2 has flourished into one of the most sought-after modern dance companies, combining a tour schedule along with a community outreach program. The Ailey School, which is the official school of the Alvin Ailey American Dance Theater, trains more than 3,500 students in a full range of techniques. Arts and Education and Community Programs is committed to bringing dance into the classrooms and communities throughout the world, with student performances, lecture demonstrations, technique classes, and innovative programs to expand on Alvin Ailey's mission, such as Ailey Camp. The Ailey Extension was created in 2005 to expand on Mr. Ailey's mission that dance came from the people and should always be delivered back to the people. The Ailey Extension offers an array of dance and fitness classes for students of all ages and experience levels in a welcoming and non-competitive environment. By making dance accessible to all people, the Ailey Extension is making a global impact from around the world. February is American Heart Health Month, a time when all people can focus on their cardiovascular health. For adults, the Surgeon General recommends 2 hours and 30 minutes of moderate and intensity exercise, such as biking, running, and of course, dance. Today, join me as I teach easy to follow choreography of Alvin Ailey's masterpiece, Revelations. We're going to start with I've Been Buked. So you're going to stand in a wide second position. This is called second position in dance. And we're going to reach through the fingertips and the arms, energy going through the fingers. And we're going to lift the chest up, which means you're going to engage your head, lifting up to the heavens. And as we descend in the music, we're going to reach and take our head over, reaching through the fingers and sliding the opposite hand up to the rib cage. And we're going to return hanging. There's a struggle in this. As we return to our starting position, swinging the head, continuing to lift up to the heavens, to the other side. And we're going to repeat the same step, reaching, the same movement. And this time, we're going to lift the hands, reaching up to the heavens. As we continue to pull the legs in, we're going to pull the elbow in, and then we're going to follow our hand up to the sky, reaching high, both arms hanging in the chest. And we're going to lift energy, and we're going to swing forward, side and back, and we're going to repeat again. Forward, side and back. As we plie and descend, we're going to cross our hands over and we're going to end in a plie, and the arms are in second position, lifting the elbows. Yes. As we come down, we're going to gather the hands, and we're going to press through the fingers and reaching straight down as we continue to lift our bodies. All right, good job. So now we're going to try it with music. This is the opening, right? The first time the audience ever sees the dancers. So let's try. Starting position. Here we go. All together and lifting up to the heavens. Yes. Energy through the fingertips. Are you going to tell your story? Alvin Ailey told his stories through blood memories. This piece is called I've Been Buked and I've Been Scorned. So let's make sure that you relay that message. And the curtain goes up. Reaching, reaching, reaching. Keep going, reaching, reaching, energy through the fingers. Gather the body, bring it in. And here we go. Breath. Lift. Cup your hands. And fingertips go. Good job. Thank you all for performing with me. All right, so thank you so much for dancing with me. Now, we're going to move on to the next section called Move Members Move. And I'm sure we all love this section. The women have the yellow fans and they have the yellow dresses. And we are all going to a Baptist church. Okay? Alvin Ailey grew up in the Baptist church and he wanted to share again his blood memories, his memories of childhood, growing up in Texas. So here we go. We're going to start. Let's make a fist. And we're going to put like right up in your rib cage. Yes, so not down on your hips, right in your rib cage. And we're going to do, as we all know, a little chug and a little church strut. Here we go. You walk front, 1, 2. You're going to turn, walk 1, 2, 2 in each directions, 2, and 1, 2. And then we're going to go 1, 2, and then you're going to point and make that point nice and strong. Yeah? And then we're going to go swing, swing, and fan yourself, and swing, swing, and fan yourself. Again, swing, swing, and fan yourself. And then you're going to go turn, and you're ready. And then we're going to go 1, 2. Let's lean with it. 1, 2. Other side. 1, 2. You got to mean it. 1, 2. And then we're going to praise his holy name. Yes. And then we got 1, 2. And then you're going to turn around and shout. All right. How'd you do? You're going to try it again. All right. One more time before we add music. Okay. And I want you to get grounded as we chug 2 to each corner of the room. And then you have one more. And here we go. A strong point. Point. Yes. Stay, stay, stay. Here we go. And sway, sway, and go. Fan. Yes. And sway, sway. Here we go. Fan. Yes. And sway, sway. One more. Fan. And you're going to turn around. And you're ready to go to the other side. Now you're at church. Yes. So you may be talking to somebody. And 1, 2, and 1, 2. Here we go. Praise his holy name. And 5, and 6, and 7, and 8, and. All right. I think you're ready for some music. Here we go. Try it again. Don't worry about it. You got this. You got this. And let's bring in that Baptist church feeling. Okay? Here we go. One more time. And remember, it's low. 1, 2. Add some shoulders. Yes. And strong. Yes. Here we go. 1, 2, go. There's somebody beside you you're talking to. Yes. Turn. And 1, 2. 1, 2. And 1, 2, 3, 4, 5, 6. 1. Good job. Thank you. Wonderful. That was wonderful. Good job. Thank you so much for dancing with me today. And remember, you learned 2 sections of Revelations. The opening act, I've Been Buked, and the spirit-filled finale, Rock of My Soul. We want to thank you for celebrating Black History Month and Heart Health Month with Alvin Ailey. Bye-bye.
Thank you so very much. How wonderful. We were able to move. Hopefully you were able to be out of your seat and move. And we thank Alvin Ailey American Dance Theater so much for being a part of this important evening. We are truly honored. And please, we always support organizations that support us and do good work. So please support Alvin Ailey American Dance Theater, www.alvinailey.org. And we also want to support the American Heart Association and all the good work they do at www.heart.org. So please keep those two wonderful organizations in mind as you go forward. We are going to, we have a treat. We have our International Trends and Services Chair, Dr. Cynthia Carter, who will just bring a few words on behalf of International Trends and Services, and we'll close our program. Thank you.
Greetings all. I am Cynthia Jacobs Carter, and on behalf of our wonderful students who now understand Revelations so much better, our students from Liberia, we bring greetings, and we are sure they are going to enjoy this as much as we all have. Thank you.
Thank you so very much. Again, we thank you so much for this evening. I will turn the floor over to our phenomenal program coordinator, Anna Maria Bishop Harris, who will then go to our Eastern Area Director, who will close out our wonderful evening. Thank you.
Anjanette, thank you. You did such a phenomenal job this evening, and you must be applauded because you've worked so hard. You really, really have put your heart and soul into this evening, and I think it shows. To all of our presenters, congratulations to you. You were all phenomenal. Thank you for everyone out there. You're here from Greater Bronx to Texas, and we sincerely appreciate that sisterhood and that show of support. I see you all, Chesapeake. I see you. I see you, Eastern Shore. I see you all. I don't have time to name all of you tonight, but we feel the love, and we thank you for supporting this event this evening. Without further ado, I want to just let our area director say the closing remarks. Shawana, if you please.
Thank you so much, Anna Maria, and to all, what an informative program. I hope that tonight we all learned something new and that we will remember that even most of us wear the Superwoman cape on a daily basis. We must take off our capes and learn to listen to our bodies. Rest, relax, and learn to disconnect from our daily routines. It's a lifestyle change that we all must embrace. Let's again thank our panel of experts, as well as the Alvin Ailey Company, who got us up and moving. We know a program like this does not happen by itself. Special thanks to our Eastern Area Health and Human Services team, led by Chair Siobhan Arline Bradley and our co-chair, Anjanette Ferris-Senatus, who planned this evening's event, our Arts Chair, Carol Seal Council, ITS co-chair, Constance Moss, and our ITS chair, Cynthia Carter Jacobs, who was with us earlier, and all under the direction of our programming team, led by our program coordinator, Anna Maria Bishop Harris, and co-coordinator, Nikina Douglas Glenn. Thanks again for joining us, and I wish you all a good evening.